Well, today, New York State lawmakers hosted a public hearing to examine the state of our healthcare workforce. WENY New York Capitol correspondent Elise Klein talks more about the hearing and hears from healthcare workers about the issue. She joins us live from Albany. Good evening, Elise.
Renata, good evening. Healthcare workers make up about 14% of total employment here in New York, according to the Center for Health Workforce Studies at SUNY Albany. And during the hearing today, staffing was one of the biggest topics, an issue that lawmakers have tried to tackle over the past several years. In a public hearing today, New York State lawmakers look at a variety of issues facing the healthcare workforce, including recruitment and staffing shortages. The New York State Department of Health projects a shortage of nearly 40,000 nurses by 2030. Some healthcare workers are hoping the legislature will make this issue a priority and enforce safe staffing in hospitals.
To help with the healthcare, the priority is safe staffing for our nurses. That's our biggest thing, to take care of our patients.
Swan says whether it's picking up shifts or being mandated overtime, many workers feel overloaded with patients. Other healthcare workers agree.
Healthcare workers are being burnt out. They are working multiple shifts, up to 16-hour shifts, to fill in holes to take care of patients.
Throughout the hearing, some lawmakers pushed for greater pay for nurses to help address staffing shortages. Lamb says a pay increase for healthcare workers would be significant.
I think overall for healthcare workers in general, there needs to be pay increases. You have healthcare workers making just a little bit over minimum wage.
Lawmakers also talked about potentially capping hospital CEOs' salaries, some of which could be hundreds of thousands to millions of dollars.
We can't get nurses because we don't have enough money. It's just too much money for these CEOs and CFOs to get.
The legislature returns to Albany in about 2 weeks, and we'll be following legislation around this issue. Renata, back to you.